Today, we are diving deep into one of the most vicious, most polarizing fights in all of modern medicine. It's a battle that pits patients against doctors and doctors against other doctors. This is the story of chronic Lyme disease and the absolute medical civil war that it has ignited.
You know, this quote from a patient, Ashley Baker, really just gets right to the heart of it all. Imagine that. You're sitting in a doctor's office, you're being told you have a very real infection, and in the next breath, you're told it's basically all in your head. It's that experience, that feeling of complete dismissal that has fueled a full-blown rebellion. So, that's our big question for today. How on earth did a disease from a tiny little insect create such a massive, painful divide in the medical community? To figure that out, we've got to look at the two opposing sides in this war, starting with the official, established view.
All right, so let's start with the mainstream medical perspective. This is what's held by, major public health organizations. It's what's taught in most medical schools. This is the official story.
Okay, so according to the consensus view, Lyme disease is pretty straightforward. You get bit by an infected tick, a bacteria called Borrelia burgdorferi gets into your system, and you get sick. The treatment, a pretty standard 2 to 4 week course of antibiotics. And that's considered really effective at knocking out the infection. Case closed.
But what about all the patients who don't get better? For them, the medical establishment has a very specific label, Post-Treatment Lyme Disease Syndrome. And I want you to really pay attention to that name, post-treatment. The whole idea here is that the infection itself is gone. The symptoms that stick around, the horrible fatigue, the pain, the brain fog, they're seen as some kind of after effect, a syndrome with an unknown cause, but crucially not an active infection.
And this right here, this lays the whole conflict bare. The consensus view says the bacteria is gone, the cause of the ongoing symptoms is a mystery, and more antibiotics are useless. The other side, which we're about to get to, says the exact opposite. They say the infection is still there, it's causing all the problems, and long-term antibiotics are the only thing that helps. I mean, they're describing two completely different realities.
Now, the official story isn't just an opinion, right? It's backed by some serious research. A perfect example is this big 2023 meta-analysis from the National Institutes of Health. And a meta-analysis is a huge deal because it pulls together the data from a bunch of top-tier studies. In this case, randomized controlled trials, which are pretty much the gold standard in medical research.
So what did the gold standard research actually find? Well, when scientists compared patients who got long-term antibiotics to those who just got a sugar pill, a placebo, they found no significant difference. None. It didn't matter if you were looking at depression, physical health, or mental health scores. The data showed the extra antibiotics just didn't provide any real benefit. This is the hard evidence behind the official guidelines.
But for tens of thousands of incredibly sick patients, that conclusion isn't just wrong, it feels like a total abandonment. And this brings us to the other side of the war, the patient rebellion, and the doctors who back them up, arguing for a persistent chronic infection.
I mean, listen to this quote from science journalist Pamela Weintraub, who went through this herself. This is what patients are trying to describe. They argue that a vague label like post-treatment syndrome just doesn't even begin to capture the severity of what's happening to them. This isn't just, feeling a little run down. For many, it's a complete catastrophic failure of the body.
And the journey to even get to that point is often just this years-long nightmare. This timeline is a pretty typical story. Early on, symptoms are dismissed as growing pains. Clear signs, like a rash, get misinterpreted because it's not a perfect bullseye. All the while, the patient gets sicker and sicker, collecting misdiagnoses like chronic fatigue or fibromyalgia. By the time they finally get the right diagnosis, the infection has been active for years, and that short, standard treatment, it just doesn't cut it.
So this leads to the absolute core of the counterargument, that this bacteria is way smarter and tougher than we've been giving it credit for. The proponents of this theory believe that Borrelia can actually hide from the immune system and survive that first round of antibiotics, leading to a smoldering, persistent infection. But is there any actual proof of this?
Well, a really pivotal case study offers a clue. It's about a pediatric ICU nurse. Someone who was incredibly high-functioning before she got sick, but then she suffered for 16 years with these devastating neurological symptoms. Her doctors were convinced it was a persistent Lyme infection. The establishment said no way. So after she passed away, researchers got this very rare chance to look for the bacteria directly inside her body tissues. Now, to understand what they found, you need to get this one key concept: biofilms. The best way to think of a biofilm is like a fortress that bacteria build for themselves. They all clump together and create this slimy, protective shield around their whole community. And the shield makes them incredibly resistant to both our immune system and our antibiotics.
And as the researchers in that autopsy study point out, this isn't some fringe idea in microbiology. It's a known fact. Biofilm infections are notoriously tough to get rid of. The theory then is that the Lyme bacteria, Borrelia, is forming these little fortresses inside the body, which allows it to survive for years, even after treatment.
And this is the bombshell finding from that study. The autopsy found Borrelia DNA and the markers for those biofilm fortresses all throughout the patient's most vital organs, in her brain, her heart, her kidneys, her liver, after 16 years of being sick. For everyone who believes in chronic Lyme, this was the tangible proof, the smoking gun they had been looking for. The bacteria can and does persist.
So you have this incredibly deep scientific disagreement, and it doesn't just stay in the lab. It spills out into the real world with absolutely devastating consequences for both the patients who are desperate for help and the doctors who are just trying to provide it.
And this brings us to that term, medical gaslighting. It's what happens when you're told that your profound, very real physical suffering is just imaginary, or you're exaggerating, or it's a psychological problem. For so many Lyme patients, this isn't just a trendy buzzword. It's a routine, soul-crushing part of trying to get help from the healthcare system. It's that quote we started with.
And for the doctors who actually dare to treat patients outside of those established guidelines, the ones they call Lyme literate doctors, the professional risk is just enormous. A recent survey found that a shocking 39% of them, nearly 4 out of 10, have been officially investigated by a medical board or an insurance company. Just trying to help their patients with the long-term antibiotics they say they need could literally cost these doctors their entire career.
So why can't we solve this? Why does this war just keep raging on with no end in sight? Well, it's because, at its very core, the two sides are operating in fundamentally different realities, and each side has science that seems to back them up. In the end, this entire massive, painful conflict really boils down to this one question. What are these symptoms that just won't go away? Are they the ghost of a past infection, as the consensus view says, an echo? Or are they the work of a persistent, hidden enemy, hiding out in those biofilm fortresses? Until science can give us one definitive answer, there's just no way to sign a peace treaty in this medical civil war.
And this leaves us with a final, really unsettling question, doesn't it? In that gap between what science can prove and what humans are suffering, who gets to decide what's real? When the data is conflicting and the experts are at war with each other, whose story do we choose to believe?